Good morning, everyone.
Good morning, sir.
Okay, so good morning. I am your nursing director, Mr. David Huniega. I will give you today a small lecture about nursing care delivery method. So, as I have told you a while ago, we have usually the common are four, right? What are the four? You have your total patient care, you have your functional, you have your team nursing, and you have your primary nursing care. Okay, so those are the most common four. But here in our hospital, we will be utilizing only two. Considering the status of our staffing in the hospital, we will be utilizing only two. Supposedly, we will be using functional nursing in OR. However, because of our staffing issue, we will be using the team nursing. Okay? So I will start now. So, okay, so what are our learning objectives? So at the end of the 10 minutes lecture presentation, the participant will be able to, number one, identify the specific method applicable to each nursing unit in the hospital, which is actually already given to you in your operational plans. Number two, state the importance of nursing care delivery method in the clinical nursing practice. And number three, discuss the policy statements and guidelines that govern the proper implementation of our nursing care delivery method here in the hospital. Okay, so based on actually we have our own departmental policy and procedure already in nursing, which is DBP UR 009.1.22. I think this is copied from Juby. Okay, so nursing care delivery method, definition of the policy. This policy, our policy in nursing, outlines the model of nursing care delivery and the method of nursing care allocation of the nursing service department to the patients of Almana Aziziah Hospital. Okay, so what is nursing care delivery model? It is a structured approach for organizing and providing nursing care to patients informed by the values and belief of our institution. So this is nursing care delivery model. Nursing care allocation. What's nursing care allocation? Is the delegation of the nursing care for a specific patient. So if you can see in the wards, you will have an allocation board. I don't know if we will have it here. Allocation board, maybe it's in the system, that every nurse is allocated for a specific patient in the area, or group of patients, and or allocation of specific nursing care activities to a nursing team member by the nursing team leader. So this is team nursing, no? If you can see. Next, nursing care. What do we mean by nursing care? Nursing care is the implementation of interventions supportive to or restorative of life based on the scientific knowledge, technological skill, and established standards of patient care. Next, you have total patient care. Okay, so this is one of the method or model that we are going to use in the hospital. Total patient care is the provision. Let's read it carefully, huh? Is the provision of nursing care by which the registered nurse or a nurse itself assumes total responsibility and accountability of providing total care to one or more patients on her shift. Like what we have in ICU. We are providing total care. Also in outpatient department. We are attending to that. Next, team nursing. Okay, this is the second one. Team nursing is a nursing care delivery model that consists of a group of nursing personnel providing care for a cluster of patients, sharing the responsibility as team members under the supervision of the team leader. So as the definition says, there is one team leader with a group of nurses, registered nurses, taking care of patients. Usually this applies in the wards. Okay, what is the purpose of our policy on this? Number one, to establish a clear accountability in the planning and implementation of a well-defined patient care delivery model. Number two, to standardize the identification of patient equity and optimize nursing care allocation. And number three, to define a system of delegation, prioritization, and allocation of nursing care tasks, and to gain cooperation and support among nursing staff in the performance of an appropriate task. This is also to avoid duplication of responsibility, so it should be clearly defined. Next, the policy statement. Nursing care is provided under the leadership of the nursing director, who reports directly to the hospital and medical director. A scope of service is developed for each clinical area, which is reviewed and updated at least annually or whenever changes occur. The scope of services will be available in our department, in nursing administration, and each clinical area. And the nursing services department organizational chart, or we call it org chart, in support of the plan for provision of care is maintained in the nursing administration and is made available in all areas to assist in the delegation of roles and responsibilities. You know, you can observe in your respective units why we are posting the org chart. So do you think the org chart will only see because this is the nursing. You don't know the actual reason why we are posting that. The main purpose of the org chart in the unit is so that you will know the delegation of authority from the highest head, the head of the department, down to the lowest position in the department. You can see the flow and the responsibilities, where you should go. Okay, next. Staff management plan is developed by the nursing director to establish and maintain an appropriate staffing level in all nursing care units. The staff management plan is reviewed and assessed whenever necessary, ensuring its effectivity and coverage, including during emergency or sudden influx of patients. So all units have their own operational plans, that the staffing plan is integrated in that particular plan. So the staffing plan is being reviewed every now and then to cope up with the demands of the unit in terms of the staffing. Next, new hire and transfer orientation, continuous competency assessments, performance appraisal, and continuing education activities are considered with the staff development plan as a prerequisite to improve patient outcomes and patient safety. Okay. The nursing services department utilizes total nursing care, as I've mentioned, and team nursing as the nursing care delivery method in the clinical areas. We did not use yet the functional because of the staffing issues. The total nursing care models will be utilized in these areas: CCU, intensive units, medical intensive care, and outpatient department. Team nursing model shall be utilized in non-medical inpatient care areas, such as male medical surgical ward, newborn nursing unit, emergency department, labor and delivery, and OR, temporarily for OR. And in the non-medical inpatient unit, team nursing is the main nursing care delivery model that must be implemented, except on the following situations as specified. Medication administration, because we have our own unit dose system, which requires 2 nurses to administer the medication. You know that already, right? The one who administers and check. Next, handling patients with special requirements like your MERS-CoV and so on and so forth.
1 minute.
Medication, drug assistant.
1 minute.
Huh?
1 minute.
Okay, next. During out-of-duty hours of the nursing director and the absence of the deputy nursing director, the hospital nursing supervisor assumes all the responsibility in the supervision of hospital operations. And in cases where complaints, conflicts, and differences of opinion regarding patient care or staffing issues arise, necessary resolutions will be made accordingly by the head nurse or shift in charge in their absence. And of course, the hospital nursing supervisor. Same through with this other policy statement, standards of the provision of holistic nursing care and nursing practice guides are being used to monitor and evaluate the quality of nursing care services. These standards are identified in the nursing policies and procedures and competencies approved by the nursing director. In view of the upholding the nursing standards, the nursing service department together with the NQI team participated in quality activities of the quality management department. Okay, for the implementing guidelines, the total nursing care models will be utilized in the critical care units like intensive care, NICU, OPD. The delivery of total nursing care model will be governed by the following principle. The head nurse or his absent shift leader of the unit will be responsible. Take note of this. For nursing care allocation, provide care requiring complex nursing skills and discussion of the care plans of attending nurses. The allocated attending nurse is responsible and accountable for all aspects of care for the patient during the shift, including coordination of care between other members of the multidisciplinary team. Okay, certain aspects of care can be delegated to non-registered nursing staff as long as it is within their job description and must be supervised by the allocated attending nurse at all times. The allocated attending nurse works directly with patient, family, and health team members. Conflicts, concerns, and issues regarding patient care are escalated by the allocated attending nurse to the immediate superior, the head nurse, or the shift in charge. Communication occurs between the allocated attending nurses during the patient handoff communication as recommended by our nursing policy and procedure. The team nursing model shall be utilized in non-critical inpatient care areas as mentioned and shall be governed by the following principle. This is the term nursing principle. The head nurse, or the same like what we have in the total patient care, no? The shift in charge of the leads a team of senior nurses, junior nurses, and any other registered nursing staff in the provision of care to a group of patients. The team members provide direct patient care under the supervision and coordination of the head nurse in his/her absence, the shift in charge of the unit. So if you can see, shift in charge is very important in every shift. The head nurse or the shift in charge of the unit will be responsible for nursing care allocation, reviews, and provides assistance in the development of care plans, coordinates care among team members, delegates roles and tasks, provides care requiring complex nursing skills, and conducts nursing care conferences between team members. So, in addition to that, so I will not go for it farther. So I think it's all. Thank you very much.